enter the room.
Hello, I'm Dr. Ria. I'm one of the FY2s in the GP clinic. Could you please confirm your full name and age?
Hi, doctor. I'm Margaret Thompson, and I'm 65.
Hi, what would you like me to call you?
Margaret is fine.
Okay, please tell me what's brought you in today.
Well, doctor, you see, I've made this appointment. My daughter helped me make this appointment because she seems to think that I could be suffering from dementia.
Okay, I see, I understand. And is there any reason as to why your daughter made this appointment?
Well, yeah, she thinks I might be suffering from dementia.
Okay, is it okay if I ask a couple questions just to have a better understanding on what's going on?
Sure, doctor.
Okay, so how lately how have you been feeling? How has your mood been?
My mood has been fine. I've been, pleasant.
Okay, and have you been having any issues remembering things lately? Have you noticed?
Yes, I guess that has been an issue. I recently had an appointment, with the bank, and it was at 8 a.m. and I happened to forget that, and I ended up going there at 1. That was the triggering, aspect of why I made the appointment. Apart from that, there have been a lot of incidences where I have been, misplacing a lot of important things and couldn't remember where I kept them.
Okay, I see. And how is this impacting your day-to-day activities?
Well, this has never been an issue before, and lately it's been happening, quite frequently, I would say.
Okay, and is it okay if I just ask you some questions just to see if how you're thinking right now? Do you know where you are?
Yes, I'm at the hospital.
Okay, and do you know what day is of the week?
Yes, today is Monday, or no, Tuesday, I think.
Okay, and do you know what year it is?
In 2025.
Okay, thank you. Thank you for answering these questions. And I just need to just ask some general questions about your if you have any medical conditions. Do you have any medical conditions?
Yes, I have diabetes.
Okay. Do you have any hypertension?
No, doctor.
Okay. And what do you take for your diabetes?
They've actually put me on a medication called metformin.
Okay. And are you taking it regularly?
Yes, I am. Yeah, I have to take it twice a day.
Okay. And may I understand who your living condition? Who do you live with?
Well, I live with my husband.
Okay. And is he taking are you receiving good support from your husband and family members?
Oh, yes, absolutely. He's very supportive.
Okay. All right. So is there anything that's concerning you from what you've talked about so far?
Oh, well, like I mentioned, doctor, it's this, episodes of forgetting things has actually been very frequent lately. Especially, I've been noticing that, happening for about 6 months, and it's kind of getting worse in the last 2 to 3 months.
Okay, I understand it must be very difficult for you, and seeing as your daughter's also booked this appointment for you, it must be quite overwhelming. So would you like me to talk about ways in which we can help support you and maybe to figure out exactly what's going on?
Yes, sure, absolutely.
Okay, so also I'd like to examine you maybe after we've discussed this, but based on what you've told me, it seems like you are having what is known as dementia. Have you ever heard about dementia?
Yes, I that's exactly why I booked the appointment.
Okay, what do you know about dementia?
Yeah, well, these frequent episodes of forgetting things. Yeah, I think that's about it.
Okay, so I'd like to just let you know that it's very common when in advancing age that we seem to forget things, and it's common in your age. However, I'm a bit worried about your symptoms as you're not really aware of what day it is and that. So for that, I'd like to look into it further just to have a better understanding of exactly what's going on. Are you with me?
Yes,
Yeah.
sure. Yeah, absolutely.
Okay. Also, I want to let you know that we'll give you some okay. Also want a better understanding about your just general health lately. How have you been feeling lately?
I've been feeling fine.
You've not noticed any fever or headaches?
Oh, no, doctor.
Okay.
2 minutes remaining.
Ooh, okay. With dementia, it's basically decline in your memory. So that's what's happening to you lately. We can work around ways in which we can support you. That will involve us, for instance, maybe we can have like a diary where you take notes of things that are happening in your day-to-day life, as well as with your medication. We can support you by, for instance, having a medication box where all your medications are put in a medication box, so you know when to take your medications. Are you with me?
Yeah, sure. I can definitely try that out. But why
Yeah.
do you think it's happening, doctor?
It's common with advanced age that our memory tends to decline, and this is happening in your case, especially yeah, and also we can do some further testing and blood testing just to see if there's anything unusual going on, just to see how your the level of your full blood count, and maybe see the function of the liver and the kidneys, just to see if anything else is going on in your body, as well as maybe looking at your blood sugar levels as well. But in your case, I'm not particularly worried about that. I'm more worried about your dementia. So we'll refer you to some to have some more support services. We can also maybe have carers being involved in your day-to-day activities. Is that something that you're thinking of?
Um, but will I get it back if I follow your treatment? Will I get my memory back?
Well, unfortunately, in your condition, it's chronic.
Move on to the next station.
All right.
Okay. I lost my trail of thought through that. Yeah,
Yeah, that really does tend to happen in these kind of
yeah,
situations. Yes, so when it comes to forgetfulness and memory, what is
yeah.
the important thing that you should differentiate it? You actually asked the question for that, but what is the important differential that you have to rule out in this case?
I'm not sure.
All right. So do you know of this entity called delirium?
Yeah, so delirium tremens. Yeah, yeah, from having an infection. Yeah,
Yes.
yeah.
So as soon as you understand there is a loss of memory, there's confusion. So you need to understand if this is an acute event or is this a chronic event? Because that question that followed about, will I get it back? Will she get it back? Do you think?
With delirium tremens, no. But with
Case will you
yeah,
actually get it? Yeah. Okay. So mainly when it comes to delirium, it's mostly an acute presentation. You might actually have like you know, underlying disease that might be actually causing you to become confused. It could be maybe, say, infection, like you mentioned. It could also be a hypoxic state. So you need to understand if there is something more insidious going on, right? But when it comes to these chronic presentation, because that was a big clue there, because she has been forgetting for a period of 6 months, which has been getting worse in the last 2 to 3 months. So you can understand that this is way chronic. So there could be, another organic cause for it. right? So you can actually ask more questions depending upon the type of dementia, right? So one important question to ask would be a family history, to understand, is this something that runs in the family, right? Because understanding the pattern of dementia, you can understand, is there a condition that is known within your family, so then you can understand what type of dementia it could be. Because there can be like dementia affecting different kinds of or different parts of your brain, right? So it could be presenting with Parkinsonism, it could be the frontotemporal dementia, it could be Alzheimer's, right? So getting an understanding of that, or understanding a little bit about her medical history, seeing that if she's had any, strokes, to actually indicate a little bit into vascular dementia, right? So all of this have like a little different kind of a presentation. Right. So definitely asking other features with these long-term conditions would be very important. Do you have any other associated issues that you have been experiencing, like tremors or difficulty initiating, a conversation or initiating movement, right? So when you're thinking about in the case of frontoparietal or frontotemporal dementia, you're actually thinking of any speech disturbances, right? And you did mention that, of course, there is, you are unable to, understand what day it is, right? So would you stop there? Like, how much of the MMSE would you go into?
I think I'd ask like more about like what the day of the week is, the days, and I think there's more questions. I don't remember them
Yeah,
specifically. Yeah.
definitely. Yeah. So
Yeah.
it's basically to understand the extent and the severity of the dementia, you need to ask a little bit of the MMSE questions. And is Dr. Farao on the Yes, Dr. Farao is also on the call. So Dr. Farao recently had a question on how would you actually ask the MMSE questions, especially, it's such a long question and how would you fit it into your 8 minutes? So I went into a deep dive and, understood how to, or, have a preliminary idea of how we can actually present it in these 8-minute stations, right? So what all are the aspects of MMSE that you guys you can tell me? I mean, it's open to everybody. So what are the different aspects of MMSE that you would ask about? Like, how much do you guys know about the MMSE? Anybody? Dr. Farao, how about you give it a go? You want to say something? I do have a fun mnemonic, by the way.
Hello, hello.
Dr. Farao, hello.
From what I remember is that you just want to check how well oriented the patient is. So you could ask about orientation, time, place, and person. Ask questions related to the time, as well as maybe ask questions that will try to evaluate how much they're paying attention, and then
Right,
try to just get give them a mini score or a bit of an idea
right,
of where
absolutely,
they
yes.
are.
Yes, absolutely. So that is definitely one of the aspects that you need to check, right? Even when it comes with an acute presentation, you want to understand. Thank you, Dr. Taku. Dr. Taku is mentioning all the different aspects of MMSE. So yes, absolutely, you're correct there. So even when it comes to an acute presentation, the first question that you ask is about the orientation to time and orientation to place, right? So that was a good question to ask. And usually 10 points are allocated for this particular aspect of MMSE itself. So understand a little bit more. You understood that the time of the day she was not able to say, the year she was able to say. So definitely ask at least 5 questions to understand how many of them she gets wrong, right? And then ask about the place, like, which country, which county, right? To get like a better understanding of whether she is aware in of all these aspects to actually give it a score, right? So but you still have a lot more aspects to MMSE as compared to just the time, I mean just the orientation. So would you want to check other aspects of this, other aspects of MMSE in these cases? Would you ask all the questions? There is a score of 30 in this case. So would you actually go ahead and ask all of it? Anybody? Yes, Dr. Ryan.
I mean, with the 8 minutes, I don't think you can. So I think you just ask one from each part. Is that correct?
Absolutely.
Yeah.
Definitely, because to actually understand any sort of a decline in memory, that itself is a very an extensive process, right? And you just have 8 minutes, so you can't actually say that you can't actually understand all the different aspects. So you did ask about orientation, and you got a few questions wrong over there. You got a few answers wrong over there, right? So ask a few more things like registration. Registration is a good thing, especially when she is, complaining about the memory itself, right? So ask her, so usually recall comes after registration, after a question of attention, right? So you want to give them a task of remembering 3 things. Immediately you want to ask them to mention those 3 things, and then you want to give them a small task where you can actually see their attention to the task that they're performing, and then immediately ask the recall of the 3 things. So this is like a good way to actually understand, how much of problem is she having in the memory itself. And another thing would be language. Language will also be a good way to actually assess if, differentiate in the type of dementia as well, the frontotemporal from the other types of dementia, right? What are the other aspects that you can actually ask about? This particular person, she seems to be having insight. Yes, Dr. Mishi, go ahead.
I have a doubt if this scenario is a telephone call, then how are we supposed to do the MMSC? Because there are like certain things, like for example, showing a pen and a watch, and asking to write something. That is something we can't check it on a telephone call. So can you also tell us like how to approach if it's a telephone call scenario?
Absolutely, absolutely. I understand that definitely is a difficult task to do. So that's the main thing about doing the MMSE in this case. So what you actually are trying to see are, you would do a mini MMSE, taking certain important aspects that you would want to check. So you are not trying to check the praxis in this case, because, if you actually are talking to somebody over the call, you can't actually ask them to draw anything. Right. So, try to move your attention to aspects that you can actually ask, because all the other aspects you can actually ask. Right. So rather than, test the things that you can't do, try to test the aspects that they can do. Right. And in all of those aspects, if they are kind of doing good and they haven't gotten anything wrong, that means there is no major impact on, the memory aspect. So what you would actually do is you would always say that I've from my examination I've conducted a mini MMSE examination where you have managed to get most of the questions right or most of the questions wrong according to how they perform. But I would like to call you in and conduct a thorough examination by asking you all the different aspects to understand the type of dementia you're having and the severity. All right. Does that make sense?
That definitely makes sense. Thank you.
Yes, absolutely. So we'll just quickly go through, exactly how you can actually fit the aspect of MMSE into your 8 minutes. All right. So first of all, let's just quickly look at MMSE. So this is definitely a challenging station, especially when you have to keep in mind so many different things that need to be asked. So in the MMSE, you have orientation, registration, attention, recall, language, and praxis and copying. All right. So in these cases, you want to definitely ask a few questions from, each of the things, but you might not actually get time to ask questions from all the domains. So whenever you see that a person is getting a certain domain wrong, then you know you will be definitely reducing the marks in that particular domain. So you would actually try to extrapolate to the fact that this person's orientation is not as you would expect it to be, or this person's registration is not as you would expect it to be. So as soon as they actually give something wrong, ask a few questions to follow it up to see how many of the questions that they get wrong, and you know that that aspect is affected. And then move on to your next aspect to actually see, how much of that are they able to perform or do wrong. Do you understand? So in the beginning, if you ask about, I'd like to ask you a few questions. Just one moment, guys. Just give me just a moment. Yeah, sorry about that. So yeah, after you've actually asked about the time, ask a few questions about the place. Ask like 3 or 4 questions to understand, how many of the questions that they actually get right or wrong. Right? Ideally, you're supposed to ask 5 for each, but still, as if they're getting more wrong, if you see that there are more questions that are questions that they are answering wrong, move on to the next aspect so that you can see if that particular aspect is affected. All right. Registration is a good, question to ask. Definitely, you would want to know how much of their memory is getting affected. So the immediate memory, where you will actually, mention 3 objects, 3 absolutely random objects, and you would ask them to repeat it. And you would actually tell them to keep that in mind, that so that you can ask them those, objects in the same order again, right? And then you would actually give them like a task where they actually need to put in a little bit of an attention and see how much of time and effort they are putting in to actually get it right. So it could be something as simple as spelling the word world backwards, or subtracting 7 from 100 each time as you go, right? Or and then after you do that, high intensive mental task, you actually ask them to recall the words that you actually mentioned before, and say it in the order that you did, right, to understand if they have memory affected in that particular aspect, right? And language is also a good thing. So one thing that is very popularly used is the repetition of the phrase no ifs, ands, or buts. Right, so this will actually make you understand if they have a problem with any language aspect. If they have a problem with their Broca's or Wernicke's, right? If they have any problem with articulation, right? So that's something that you would want to understand, when it comes to dementia. So how would you actually incorporate all of this into your 8 minutes? That's a good question, right? So I understand it's definitely a struggle, and I'm really glad to be taking this particular scenario because this has been coming a lot lately. So initially, as Dr. Rian had like a very good, strong start where, you're trying to understand the perspective of the patient. You're trying to understand what is their complaint, why do you think it is an issue, why do you think it's a problem, understand how it's impacting their life, right? Now, what are the instances or what are the incidences that have led you to believe that you might be suffering from dementia, right? That question also brings about the fact if they have insight or not, which is very important because in cases of frontotemporal dementia, these patients don't usually have insight. They have absolutely the opposite of it, right? So they may actually act, in a non-social manner where they might be using a lot of abusive terms without even knowing that, they are offending someone. So those are good ways to understand, if this patient has insight regarding things that she might be doing right or wrong, or if she actually feels that she has been forgetting things often lately. Right. And another aspect of insight is you're actually thinking in the lines of psychosis, right? If this patient has been having any of the psychosis symptoms, right? So do ask a few questions when it comes to, these kind of mental scenarios, these kind of psych scenarios as well. Just ask a few questions just to rule out any psychosis. Do you hear sounds that others say that they haven't heard? Have you been experiencing instances where you feel somebody has tampered with your thoughts in the way you think, or has managed to steal thoughts, right? The thought disorders, right? So all of those would be a few questions that you can ask to just rule out psychosis, because that's again a good, important differential that you have to rule out. So definitely, as soon as these cases come, rule out the most important thing, which is differentiate between delirium and dementia. So understand the progression and the duration of the symptoms that they have been experiencing. Understand a little bit about insight, if they have insight. Understand about all the other associated symptoms that you can think of, to rule out different, other differentials, like any tremors, right? Any problems with speech, the psychosis symptoms, right? And then once you kind of narrow it down to, another important aspect is family history and medical conditions, because, that will actually help you determine what type of dementia it is, right? And after you've actually done that, now you want to check the severity and the amount of dementia, right? So you would want to do a little bit of your MMSE there, right? So even when you're actually doing a questionnaire like MMSE, do first introduce it to them, right? So one way to actually say that is, Mrs. Thornton, as part of understanding your memory concerns today, I'd like to do a short test to check different parts of your thinking. It would involve me asking you a few questions and some simple tasks. Is that okay with you? Right? Because the questions that actually come is not that you actually ask for MMSE is not generally what you would ask anybody in a consultation, right? So definitely give them an idea of what you're doing before you actually do that, right? Orientation. Ask a few questions about orientation. Ask a few questions about registration, attention, recall, language, just to understand which aspect of their memory is getting affected. And as you see that more questions that they get wrong, abandon it, because that itself gives you proof enough that the first few questions of MMSE is wrong. So certain aspects of her thinking are already affected. So you are thinking along the lines of dementia, right? And as soon as you manage to find out that the majority of the questions, or a couple of the questions that you are asking, are coming to be wrong, you would want to move on and understand a little bit more about her condition and move to management immediately, because there is a lot of management that you can do over here, right? The examiners are not really trying to test you on whether or not you are able to say the different aspects of MMSE. They are trying to understand the fact if you are able to diagnose this patient with having any problems with thought or memory, right? So as soon as you actually make that diagnosis, as soon as you actually understand that a couple of questions that you are asking from the questionnaire is coming out to be wrong, that means you've actually gotten your positive findings. So move on to actually asking different aspects of the data gathering, right? What are the different aspects of data gathering that you should keep in mind in these cases? You need to understand about the medical history. Definitely, that's very important. Any past medical conditions that they have had, like any mini strokes, all the comorbidities that they have been suffering with, and medications that they are on, if they are following the regime that was given to them, right? Because these are additive factors that can, what to say, hasten the progression of a mental condition like this, right? Family history is also very important, because usually in such organic brain causes, it's usually seen in over generations. So you would definitely want to know what, just to, what to say, bring down your differentials. You would want to know what exactly would you want to right? If there was a condition that was already in the family, then you would be actually testing this patient for that particular condition, right? Asking questions more tailored to that particular condition, right? And other aspects, social aspects, like who they live with, how is it affecting their daily routine, asking them about their job, how it's affecting their job, right? That's also a very important thing, because ultimately you're not just treating the patient. I mean, you're not just treating the disease, you're treating the patient on a whole, right? So understanding how this particular disease is actually affecting them on a whole is something very important over here, because that's the management you're planning to give, right? So understanding the different aspects where this patient needs help, you are going to make a management plan for them. All right. So let's look at the management plan. So when you actually start with the management plan, you can actually, go into mentioning that, from the information that you have provided me and from the questions that I've asked you, it does look like, you could, be having some aspects related to dementia, right? And narrow it down for them a little further by, pinpointing a particular condition that you think it could be. And that would actually come if you have an idea, like in case of Alzheimer's, which actually does run in the family, or any family history of a particular condition, even Parkinson's as well, you would actually want to pinpoint it into that particular condition. Since you mentioned that this was something that your relative or your immediate first generation relative has experienced, this could actually be that condition as well, given your age and the presentation that you have come in with. All right. And so one thing that you need to understand is you don't have to make this diagnosis. You are at the primary center. So you're just screening these patients. And once you feel that there is a likelihood for them to actually be suffering from this condition, your job is to actually refer them for further testing, refer them to rehabilitation centers that can actually help with their day-to-day activity. So that is exactly your role. So to understand that this patient is actually suffering from any aspect of this disease, and to understand the different, different areas of life where it is affecting them, is what is expected out of you, so that you would be able to offer them help in actually improving their life, or their lifestyle, or reducing the impact of this particular condition on their life in a whole. Right? And always, after you have had this basic conversation, the main thing that you need to do is you need to understand the patient's issue, the patient's idea of what help you could be offering them. So a good tool to use for that is ICE. Try to understand what exactly her concerns and what exactly is her expectations. What does she expect that you would be able to help her with, right? So that you can actually perform your task right down to the issue that the patient has. Yeah, does that make sense? Any questions, any doubts? Dr. Rian, are we clear with this case?
Yeah, thank you.
Yeah. And as a part of investigations, you definitely have to do further investigations to rule out any organic causes that could be actually causing this. If there are any reversible conditions that you would want to investigate and give management for, you would actually want to investigate for them. So definitely mention the blood tests that you would want to do, also vitals, just to rule out all the immediate acute causes that could be causing this memory problem, right? And the right referrals. So where all will you be referring them? What is the lifestyle advices that you would be giving? That is very important in these cases. So definitely the memory clinic, where they would actually be doing a proper MMSE, or a proper cognitive test to understand the extent of how much this is affecting them, and if to pinpoint the severity of dementia. If needed, they would actually be doing some further testing in imaging, such as CT and MRI, to actually find any organic causes that could be responsible for for the condition itself, right? So that is your mainstay that you would require to do. Otherwise, all the other supportive management that you can actually be giving them. So you did mention something about the Dorset boxes, for what is it, medication, since you know that you've understood that she's actually taking medications. So that was a good one, you know. So you actually understood that this could be potentially affecting her taking her medications, even though it is not something that has affected her right now. So, you know, to bring about a routine in actually taking those medications is very important, right? So that's what you would want to establish, you know, bringing about a routine in their daily life, so that, you know, they that would actually help them perform their daily activities. So that is something that you would want to do. The other thing that you very correctly mentioned is diaries, notes, alarms that can actually help you with remembering different aspects of what you are supposed to be doing on a daily basis. And other supportive treatment like a proper diet that can reduce the progression of this disease, an exercise routine, right? Keeping themselves more social, more active. So a lot of research has been done on how we can actually improve dementia, and it is seen that educated people who have more social interactions, their cognitive decline is seen to be relatively slower than the ones who are uneducated and don't engage much with other people in the society. So it basically comes down to the more brain connections that you can make, right? So definitely you would want to encourage them to take on a few more social engagements that can actually help them in their day-to-day life and improve or slow the progression of the disease. So you would want to put it in that sort of a sense, right? And the other issue that you should definitely be keeping in mind is DVLA. So if this person is seen to be having dementia, there is a very likelihood that they may actually, be at risk to the society. So whenever you identify a particular disease, you need to understand if you're actually sending them back into society, how would that be affecting the rest of the people in the society? So understanding any risk that could actually arise from that, you need to identify it and properly instruct them whether or not to carry out those activities. So DVLA is one important thing that you should definitely try bringing into this particular scenario, right? And safety netting, follow-up leaflets, pamphlets. So definitely do try to incorporate these three aspects in every one of your consultations. Somehow or the other, they do have an important role to play when it comes to management. All right, I think that was a pretty lengthy conversation that we had, but I hope you guys are clear. Do you have any questions, any doubts when it comes to this particular scenario? Anybody? Thank you, Dr. Farao. And yes, the MMSE, the mnemonic. So I'm not sure if everybody on the call is interested, but we have actually written a short blog for this, and you guys can do refer to it. So the mnemonic that I found was very interesting was something called Oracle, like the soothsayer. So even though not all the letters correlate, but it kind of does can make sense, like oracle, thinking, foresight. So O for orientation, so it usually carries 10 marks. R for registration, A for attention and calculation, C for copying, L for language, E for recall. So I've given E for the RE recall part. The more important thing about this mnemonic is that you can ask these questions in any order, but make sure that the order of registration is always kept, one step ahead of recall, because you're recalling the questions that you ask for registration. So that is one important aspect that you guys have to keep in mind. But this is only if you have to do the entire MMSA. Right? That might not be the case. In this case, you're actually trying to understand different aspects of MMSE that have been affected, so that you can bring it in your management saying that, yes, I can see that there has been a significant decline in your cognitive function, or say that in simpler words, in your thought process or in the way you think. So we would definitely want to investigate more about why this is happening. Yeah. All right. Let's quickly look at the scores. Just one moment. I'll just pull up the scores. Sorry about that, guys. Right. Yeah, let's quickly look at the scores. All right, so to start off with, you asked the patient identifiers. Good job on that. Full name and age, that was good. Ask about the reason for the visit, so you understand that this is something that even her family members are noticing. It's not just her, it's also the family members. So that kind of gives you an extra clue that, you might be actually looking at a true dementia case, right? So my daughter seems to think that I have dementia. Definitely, that is one question that you want to follow up with, like, why do you feel, she feels that way? Are you also of the same opinion that you might be suffering from this? Right? Why do you feel that way? That way they'll actually give you the different instances why they feel, or what are the different, impact. I mean, different incidences that they have had for them to feel that they might be suffering from dementia, right? Explore symptoms, ask about memory issues, specific instances, frequency, how often is this happening, ask about onset, progression, like, since when have you been noticing that this has been happening? Has it been getting worse, right? Assess cognitive function, inquire about difficulty remembering new things, forgetting names and significant dates. So that's another thing, like, are you able to form new thoughts? Are you forgetting the thoughts that are you forgetting the, the memories that you have been having beforehand? So these are the questions that you need to be having in your mind. Like, are you able to form new thoughts? Are you forgetting new information? Are you forgetting information that you've had from before? So you can definitely ask those questions in a way, that they are able to pinpoint on those, aspects. Right? Evaluate daily function, ask about getting lost, driving, managing, daily activities, right? Rule out reversible causes, ask about recent infection, UTI, any chest infection, also any stroke, any hypoxic condition that could actually be, adding on to this, this disease. Rule out vascular dementia, ask about past stroke, mini strokes, or cardiovascular conditions. Mental health check for hallucination and feeling of depressed. Good job on that. But definitely ask for hallucination. You definitely want to rule out the psychosis aspect, right? Medical and family history, confirm past medical history, condition, medication, and family history. So I'm going to give you a partial for this because that is a very important question to ask, right? You never really asked about the family history part of it. Social history, inquire about living situation, daily routines, diet, exercise. This is the way you can actually implement that in your management itself. You want to improve their lifestyle in order to improve their condition. So to understand their baseline lifestyle already is very important. Yeah. Otherwise, social history, inquire about their, living situation, daily routine, exercise. Oh, I think we already did that. Perform MMSC, orientation task. Can you tell me today's date, day of the week, where we are right now? Understand how many of those questions are they getting right and wrong, to actually understand that, okay, fine, I've got a positive finding in this, aspect itself. Then a couple of other aspects like registration, attention, recall, language, right? If you have the time, if you see that most of the things that you're asking, you're getting right, move on, because you've already got your positive finding for dementia, right? Move on and, ask other aspects. Because when it comes to acute conditions, like when a patient comes in with, say confusion, a delirium sort of a state, the questions you just, you always, ask them just orientation to time and place. There's nothing more that you actually ask. You're not actually asking about the memory and its impact at all in these cases, because you're trying to keep it short. You're trying to understand how much has, it affected the orientation itself, right? So understand the situation that you are in, because you have only 8 minutes. So understand that you have only a fixed time to, find any positive findings. So as soon as you get positive findings, move on. Don't waste your time in asking the entire questionnaire, right? Because you'll never come to management, and management gives you 4 marks there. So you need to explain in words what your findings were. And since you were not able to conduct an entire MMSC, you can always bring it back in management saying that, we would set up a follow-up where I would be able to do an entire MMSC examination to understand the degree at which, you are having this dementia and its severity. Yeah. Registration task, attention recall language. Yes. After that, also you can do vitals, like just to understand if there are any acute causes, if, fever, heart rate, respiratory rate, and saturation, if at all, if they are abnormal, then you would actually think of any acute causes that could be causing this, Discuss findings, summarize concerns and findings with the patient, reassure and educate, explain memory issues and the significance of MMSE result, explain the possible differential diagnosis, including dementia, depression, thyroid disorders, vitamin deficiency, and medication side effects. So say that at this point, it does feel like you might be having some aspects of your memory that are affected, but we'll have to do a few more, tests to rule out other causes, that could likely be causing it. And if so, we would be able to give you the treatment and reverse the condition, right? So at this point, you don't even know what is the, underlying condition that is causing them this. So when it comes to that question of, is this reversible? This is a good way to answer that, right? So apart from that, reassure that memory issues can have many causes, not always dementia. Arrange immediate blood tests, routine referral to memory clinic for detailed cognitive assessment and possible neuroimaging. Immediate advice, avoid driving and provide memory aids. Advise lifestyle measures like maintain routine, use memory aids, adopt Mediterranean diet, regular walks, and social engagement. Follow up, arrange follow-up appointment, and provide contact for urgent concerns. Safety netting, seek urgent help if sudden worsening of confusion, hallucination, significant behavioral changes, or getting lost occurs, right? Leaflets and pamphlets provide written information on dementia and memory clinic. Interpersonal skill, empathy, and active listening. That was done very well. At no point did you actually cut me off. That was good. Clear communication, use simple language, and ensure understanding. Building rapport, maintain eye contact, and encourage questions. Respect and sensitivity. Involve the patient in decision making and be sensitive to emotion. Signposting, guide the patient throughout the consultation process, reassurance, offer hope for improvement with proper adjustments, right? Yeah. And a couple of things, yes, definitely consultation. Yeah, try to be organized where, in the beginning you're asking questions. Already when you're asking questions, start formulating your management plan so that, you know what you're going to be offering them in management. Diagnosis, yes, definitely. Findings, issues, and management. And I would also give a little bit for time, right? Because there was a lot more that you could have actually done. All right, so Dr. Rian, that was your first go.
Please like and subscribe to Turing Med School. Good luck with your preparation.